Ladies and gentlemen, it is my pleasure and honor to introduce you first to Anaheim Union High School District, and I have some great friends and colleagues that I've been working with out over the, I guess, past 2 years now over at Anaheim. And beyond CEI, I've also had the honor and pleasure to work with them on a variety of projects that I've brought them in, aside from CEI, to support other districts and support the work that we do as San Bernardino County Superintendent of Schools. And so at this point, I want to introduce you to one of the leaders who will then introduce his team, Mr. Joe Carmona. So Joe, take it away.
Thanks, Mars. Good afternoon, everyone. I really appreciate you being all here. I'm very excited to share some of the work that we've done. I'm the Director of Special Programs and one of the leads in CEI. Carlos.
Thanks, Joe. Carlos Hernandez. Good afternoon, everyone. Carlos Hernandez, Director of Curriculum and Instruction for Anaheim Union, and under my office, along with many of you, we work with Family Community Engagement. So I'll popcorn over to the Coordinator of Family Community Engagement, Araceli Chavez.
Good afternoon, everybody. Araceli Chavez, and like Carlos said, I'm the Coordinator for Family and Community Engagement at the district. So happy to be here today.
Hi, my name is Maria Trujillo. I'm the Family and Community Engagement Specialist at Savannah High School.
Hello, everybody. My name is Rick Parmenter. I'm the Title I Coordinator at Savannah High School.
And I think that might be everybody from our team right now. So I am going to share my screen. All right, so Anaheim Union High School District, we're gonna jump right in. We have about 20 minutes, so I wanna make sure we share everything that we have on our agenda. So a little bit about our school district. We have just about 30,000 students. We are a 7 through 12 district. We start at the junior high and move through high school. We're about 71% low income students. And actually during the pandemic, that's creeped up closer to 80% as our community is a lot of service industry jobs, which have been disrupted quite heavily due to the pandemic. We have about 20% English learners, 10% homeless students. There's a number of motels in our area where many of our students actually find themselves residing in. We're a predominantly Latinx community, but also serving Asian, white, Filipino, and a small percentage of African-American students. So just a little bit of background on our demographics. So our problem of practice and our team members who are here along with, unfortunately, our parents are not here, and they actually heavily influenced how we landed on this problem of practice, right? So our problem of practice was to strengthen district systems to engage disengaged families, and it's a little awkward, but that's what we went with, to address non-academic needs. So just the background, why non-academic needs, right? Why emphasize that piece of this problem? And that's because as our team wrestled with what are we going to really focus on this year, the voices of our parents were very clear that, yes, I want my child to be engaged in distance learning and I want them to be completing their assignments. But that all wasn't really the thing foremost in a lot of their minds. And so we did, for ourselves, internally focus on around the work of family and community engagement, right? Obviously, there's many components of what we do as a district, but for this work, we wanted to focus on these non-academic needs. Just in terms of how does our problem of practice connect to the 6 root causes of, poor engagement? When we look at the, from left to right, the first and the last, it really calls out the system. And that's a strong point of emphasis for us, that the systems are what matter, right? The people make the system work, but one person or a couple great people is not a system. And so really making sure that what we are building is systemic. And so that's really why our problem practice addresses these two pieces of some of the barriers, right, to effective family and community engagement. So as we kind of wrestled and put this together, you know, our problem of practice, we're like, well, why? Why this problem of practice? And part of that is because the impact in our community, as many communities across the country, right? Unemployment, increased poverty for our families, mental health issues resulting from a variety of reasons, isolation, grief associated with the loss of loved ones or family members, and just the sort of grief around loss of normalcy, right? And this increased disengagement. And so part of what we wanted to accomplish was developing shared responsibility for action across our school sites, right? So we have one school with us, you know, today as an example of some of the things we've done, but really across our schools, working with our community-based organizations, and really, you know, how we coordinated with our city government, our elected officials, local businesses, and then you know, very importantly, our residents and families within the community. So I don't know, anyone from the team want to add anything to this about kind of the why behind we really looked at these non-academic pieces?
I'll just add that as we were discussing this a few months ago, gosh, it feels like it has been. We were right in the thick of COVID and the impact. So just stepping back a few months, you know, and for you to do the same as well, we had in our face experienced a loss of a student, as an example, you know, by suicide at one of our high schools. And as we peel that onion and try to understand and just try to reflect our families, the impact that made, everything that is listed on the screen was exactly what that family and more that we don't know, you know, but was experiencing. Unemployment, you know, increased disengagement at schools, definitely mental health issues. And so, you know, it was in our face, and unfortunate that is where we are. You know, months later, we're still grappling with those challenges that we know that even as we return back in person, we need to continue to keep this problem of practice in mind.
And
Joe and Carlos, just if I can add as your county partner with this, I remember in our discussion, you know, one of the things I can say is that you guys are so strong in Anaheim Union of really looking at your parents and building the capacity for moving into, you know, future educational things that will connect students to college and career and all those things that were happening. And I remember part of the conversation was the struggle with, we feel that systemically we're doing really well with this, but why have we seen this disengagement? So I think that's why this POP was so critical for you guys to really almost step back and out of it for a moment and look at it with the lens of, you know, why is this happening? We have so much of this that's going on for us, but it was very reflective. And I see Susie putting that in there. It was really that moment of saying, you know, it really is about the fact that we have to step back for a minute and really look at that Maslow's and those needs and what's happening in real time with our families right now. So I really respect the fact that this is what you guys landed on, because it's so critical to really knowing and meeting families where they currently are.
Thank you, Sri.
so again, so with that, right, talking about how we approach family and community engagement from the lens of systems. And so I'm going to talk about two pieces of that today. So one piece is around the systems approach to engaging our families. And so you see here in the center, we have this little, pictogram, which really captures our mindset around family and community engagement, right? Those pieces around environment, establishing trust, building relationships. And so within kind of each piece of that pie, there are different things that we've done over the course of this year, right? So, we, when you talk about, building relationships, we have family and community engagement specialists at all of our sites, and then with, we supplemented those with additional community liaisons, with some of the resources that districts were provided during this time, right? Events we had done in person, like Parent Leadership Academy, right, which is building the capacity of our parents, and the, our monthly coffee with the principals, right? Those transition to virtual formats, where we actually saw an increase in some participation, right? Because folks could jump in on Zoom, right? So some practices, right? We're gonna continue on when we, emerge from this, and around establishing trust, right? That's really the job of every person at the school site, to establish that trust with our students and families. But that for us specifically meant helping folks understand why it's important for testing and vaccination, and not only providing that access at our school sites as trusted places within our community, but then also providing information to them to help better understand, especially the vaccines. And I would invite Carlos maybe to touch on that, because that's really a partnership, right, with our community that has paid a lot of dividends recently.
Yeah, so when January, when the vaccines became available to our community members, there was a lot of hesitation, I'm sure in your community as well. And so big shout out to our teammates along the way, Santana Unified. We heard that they were hosting these Q&A sessions, these chats with these medical experts. We said, well, that's a phenomenal idea, because I think through that, or that partnership, that trust, and then you bring in medical experts. Let's host some town halls and invite our medical experts that we have relationships with. Dr. Jose Mayorga from UCI Health, as an example, came into our first town hall and really wanted to have that Q&A. Just simply, here's the information of the vaccine. Here's the science behind the vaccine. All right, but what are you hesitant about? We did a pre-assessment. We simply asked, are you comfortable right now? Right, and a significant amount, a percentage, said we're not comfortable. I don't know enough. Simply, I'm not comfortable with the vaccine. And of course, the vaccine is one layer that we're touching on. As the end of that town hall, questions were answered just about everything that they're worried about. I heard about the chip that gets placed in your, in your body. I heard about this. My neighbor, this. And so, as Dr. Mayorga went through and eased or at least gave them the accurate information, we did a post-assessment to see where they were at that point. And they were significantly more comfortable. In fact, almost 100% said, I'm comfortable. If presented with this opportunity, I am ready to get the vaccine, right? And so we want to, be able to inform our community, our family, and we do that in partnership with those relationships we have, to be able to continue with that trusting environment and the trusting relationship. We also did mental health town halls that also talked about resilience and recovery, not just what are we doing today, but how do we see ourselves moving back in person when students return, adults are, and thinking about adults and students. So it was a lot of Q&A. And so simply that ability to be vulnerable, to say, we need you as partners. We can't do this alone. Once you build your capacity in that town hall, have your neighbor, help your family member, help someone else, and to help them feel comfortable with where we are.
So, with that, as we talk, thinking about the system, what is the system to engage our families? So this slide about the family and community engagement team at the site level, right? And so you see that there are, different roles that are very critical to this, right? So it's not just the faces who has that responsibility, right? But that's also our partners, right, out in the community. It's our teachers, it's our support staff, our counselors and social workers, the administrator as one of the lead people there. And so, as we have, right, our problem in practice was to strengthen the district systems. So you see this sort of little plus symbol next to certain roles here. That's where we've used this temporary COVID funding we've been giving to add support to those areas, right? So we didn't make up something new. We didn't, have to reinvent the wheel. We had a system that we strengthened and gave more power and resources to meet the needs of our families. So I think Maria was here. I don't know if Maria or Araceli, you want to add anything about, how we've added additional resources around some of these roles. Maybe, yes.
I don't see, I see Araceli Chavez, but I think she's
Yep.
in 2 different trainings.
Yep. So, right. So just as an example, right, we have the faces and they said, we're getting calls about anything and everything every day. How does my student log on? Where can I get, we need rental assistance. We need food. We need, right? And so we brought on community liaisons. We actually brought on call center staff that could answer some basic questions for parents. So then our staff could connect families to those resources, because we know some of the work that has to happen is the linkage, right? Getting them linked up to the right resources, and then really bringing our partners, and our partners have stepped up. You heard an example about UCI, how they've stepped up, and we've worked with many organizations in our community who've provided food distributions, right? We were doing that already at several of our sites, but really that's amped up to the majority of our schools have had, a monthly or bi-monthly food distribution, right, to supplement, our families and to continue to meet their needs. So, right, again, the idea that the system was there, and so we just built upon that. Rick, you wanted to add something there?
I was just going to say, an example is the partnership that we have grown with Saddleback Church. With those food distributions, we've served anywhere from 600 to 1,000 families once a month, filling up their trunks with food and needs for the community. Just a simple example.
Yeah. So, great partnership, right? That was there, but really has been amped up, right? As a result of this collaboration. So the next piece is when we talk about our systems, right? So our problem in practice was around non-academic needs, but that doesn't mean that we still don't have to engage the students, right? And so this is something that I'm going to let Carlos talk a little bit about, right? In terms of, as we've worked through these challenging times, now, right, it's not just about getting through it, but continuing to strengthen our own vision. And how do we jump off now, right, into next year and the years beyond?
Correct. Thanks, Joe. And I know we're short on time, but this is our next step to continue to address this problem of practice. This is our journey that we will continue. We are in a place of pivot, an inflection point, if you will, right? Economy is down, job loss around our community is tightening up. Where we know that there are hardships in our families and our students in our community with whatever, everything that's going on in our environment. Where are our students as we approach, in person and thinking about this system's approach? It says engaging students, but by extension, we mean engaging our families as well. So the same approach, at the top, it is not by accident that we have youth voice and purpose. It is that through line, that supporting their voice, identity, and purpose is how we will engage. Yes, there's soft skills that we continue to talk about along our 5 C's. You saw that image, that what is happening every day in the class, every period, inside and out of the classroom. Yes, there's technical skills, hard skills, certifications, dual enrollment, things that we will continue to enhance. And, the student's voice and purpose matters so much more than ever before. And so this approach, this framework is how we're going to move and lead. And that means everything we are doing, we're reorganizing our time spent at the district level, at the site. We're doing in sort of re-envisioning and retreat summertime where we are doing these kinds of things, because we need to ensure that our assets in our community are brought together in this way. And that is our business partners, that is our nonprofits, that is our students, our families, right? To move forward in re-engaging those disengaged, but continue to engage those that are engaged, and to continue to work with that in mind.
So, Mr. Hernandez, you're getting me all excited right there. You're getting a little fired up, I can tell. But one of the things, right? So, and that work isn't like in a vacuum, right? It didn't start today, right? But, even in the spring, we tapped into our students' creativity, asking them to create during COVID and promoting their projects on our social media. And then this year, again, when we talk about addressing non-academic needs, we actually rolled out lessons across all of our sites with this essential question of what can you do to slow the spread of COVID-19? And what impact will that have on your community? So again, bringing the students into that conversation and relying on their expertise, their perspective to help us get better at what we're doing as a school district. So there's more there, but I know we're coming to the end of our presentation. But when we talk about family and community engagement, one thing that, especially as a district who serves high school students and older students, you have to really consider the students as their own part of the community, right? It's not just about with their parents or the business partners, but they are an essential component, and their voice is so critical in helping us to be the best district we can be and provide them an education that's meaningful for them. And I think that slide about the framework, that's really what that is, right? Providing them an education that is really meaningful and prepares them. So just to kind of connect the lines, our problem of practice, they're the root causes, and then back to this idea around the shared responsibility, right? That to help our students get there, it is a shared responsibility of, reaching out to your elected officials, working with those business partners, working with your university partners that are in your area to help achieve these outcomes. So we have a few minutes for questions, I think.
So this is a good time, even if you want to put a question in the chat or you want to unmute yourself and talk to the Anaheim team.
With the vaccine push, are you guys actually vaccinating like at your school campuses, or is there like a collaboration between your county words have failed me public health office to get your sophomores and up vaccinated?
Yes to both. So yes, we've had a partnership with Orange County Healthcare Agency since January, and again, Santana's in the house as well, our teammates there. So there's a coalition, right? That said, gosh, this idea of going to these super pods that are serving those families that can drive there to get those vaccines, awesome. What about our community, those that need it the most and that are most vulnerable? We need our neighborhood schools to be a part of the solution, and so that's what we did. We've been hosting during the week, and I know Araceli Chavez is in 2 meetings, but during the week on Saturdays, vaccines depending on who's eligible and what. And now we've partnered directly with UCI Health that has a health center in our community to be able to host every day ongoing. So yes, yes to both. And I don't know if Araceli, you want to add anything to that.
I just want to add that the nice thing about this collaboration with the community clinics and the county having these pods at our high schools is the fact that they come to vaccinate as families. So our families come, parents get vaccinated, their children are getting vaccinated. And now hopefully, if Pfizer, if we move forward with the 12 to 16, then we'll be able to vaccinate even more children, right? So it's really nice to see, the family come and see this as a very special thing, right, that they've been waiting for. So it's been awesome.
Yeah. So there was a question in the chat around, are we going to continue this problem of practice moving into next year? And so what I would say to that is what we're planning right now. So for many of you, you might have opened or partially reopened, right? So right, we have not, right? Our students have remained in distance learning, right? We'll be opening up in person for summer school, and then in the fall, really moving, hopefully to a full-time, right? 5 days a week, all the students on campus. And so our discussion with our school sites is that we've actually been using the term like a care opening, right? And thinking about that addressing the non-academic needs, right? The social needs of our students, that's not going to happen in 1 or 2 days, right? That's not going to be satisfied with some, balloons and assemblies at the start of school year. That's really going to be every classroom attending to the social and emotional needs of students for potentially a month, right? And so, yes, we have a responsibility to address their academic needs. However, that has to be done in a way that attends to those needs first, right? And so, the training that we're going to be providing our teachers at the beginning of the year before the students arrive is focused around those pieces, right? Engagement, the social emotional learning components, right? Because again, we've had pieces of that, we've talked about it, but we're really setting the stage that like probably 2 or 3 weeks is just focused on allowing our students to get back onto campus, to reconnect with one another, to have our staff reconnect with one another, knowing that some folks are still going to be anxious, right? And so, like, if you study anxiety, anxiety is a magnet for negative thoughts. So they're going to be anxious coming onto campus. So if someone says something to them, they're going to go to the worst place in their mind, right? Or if they're not in the right class or something, like, it's never going to, right? Like, that's what anxiety is going to do. You're going to, like, all these things that are not that big of a deal will be ramped up. And so we have to be very intentional in the way we address all of that. And that's the discussions we're having with our sites right now. Like, what is that going to look like for you? What is your plan? And knowing that, like, this is our opportunity to have sort of like kinder, gentler schools, right? Like forever. So got to get it right, right on from the first day of school. So, I mean, those are big goals, but that's where our internal district planning is right now, around kind of continuing to address the non-academic needs of our students and families.
So I see another question. I'm wondering what metrics you are using to measure the effectiveness of your action plan? Student surveys, attendance, other.
Yeah, so that's a great question. As the person who is working on the LCAP, got a lot of metrics on my mind right now. And so I think, yes, the attendance is going to be really important. We've used surveys quite a bit, and I know we will continue to use them. I think one of the feedback loops we're working on is how do we get input at the site level, right? How do the sites get input that it's working for their students? You know, that's one of the things we continue to look at. And you know, we have a strong focus on civic engagement in our district. And so we continue to look at ways that we can measure that at our sites. You know, Savannah, who's here with us, is a great example of that. You know, and so we look at, you know, they have capstone experiences, right? I think you guys just facilitated, right, Rick? And right, and that's sort of like a pretty much you're getting graded. The students are going to let you know how their experience was, right, over 4 years. So I don't know, Rick, if you want to share a little bit about how you guys get feedback from that kind of experience.
Yeah, you know, I mean, it's an age-old question in terms of how do you best collect data on things that are not, you know, state tests and not just, you know, DNF data. And so it is a challenge to do that. We have looked at things like, you know, national clearinghouse data and things like that. We've been doing our capstone program for almost a decade now. And it's a school-wide program. Seniors interview. We just interviewed, we in 2 days, we interviewed nearly 80% of our seniors already, just in terms of their articulation of the soft and transferable skills that prepare them. And as we've looked at data over time, and we've compared, you know, things like A to G rates and graduation rates and persistence data. You know, the persistence data in terms of continuing on in college after the first year has grown significantly, more than most of our neighboring schools and even the other schools in the district, just based on you know, the difference in that program that we have and the buy-in from all the stakeholders with it. I mean, we had in 2 days, we had over you know, 165 panelists that were engaged in our capstone interviews for each day, including partners through United Way and AAA and companies like Reborn Cabinets and those that are in those industries. So we're always trying to engage as many partners as we can, and then look at how students are performing and what they're doing as they leave Savannah or, you know, any of our schools. To see if what we're doing is really making a difference. Another piece of data we're trying to start to collect too is, you know, in our parent ambassador program, you know, how are the kids doing in comparison to those that do not have as much engagement from their parents at home, let's say, in that particular capacity. So those are the kinds of things that we're trying to look at that are sort of more outside the box, as opposed to just, like I said, grades and state test scores.